So the slump test is another alternative that we can use to help determine whether we have sciatica. It's a nice alternative to the straight leg raise, particularly if we find it difficult to lie down comfortably or lift our leg, because this test is done in sitting. The principle is the same though. With this test, we are stretching the nerve like a piece of string that runs all the way down out of our back, down our leg. If there's an irritation to that nerve, then there'll be a restriction potentially in the range of movement that we can get, and an increase in symptoms if we stretch it. How we do the test is we basically just sit down, and first of all we do it in stages. So the first thing we do is slump. We slump down and we see if there's any increase in our leg pain. Now if there is, test over, you're done. It's a confirmation that you have some sciatic symptoms. If there is no sensation that's a particular problem, then what we'll do next is then take our chin down to chest and add a little bit of tension. We'll see whether there's any increase in symptoms, and once again, if there is, we will stop the test. That's a confirmation we've got sciatica. If there's still nothing, we'll move on to then pointing our toes towards us and then lifting up the leg and straightening it, and that will increase the tension on the nerve. And this one in particular is usually something where you can feel the sensations if you have sciatic symptoms. And we compare leg to leg, and like the straight leg raise test, it will also be likely to be restricted on the painful side. So we will do the non-painful side first in terms of straightening the leg, and then the other leg we'll do, which is the painful leg, second. And that's as much as you should do. Do not repeat the test if you have a confirmation of an increase in symptoms.